Welcome to What's Going On with Lady D today. I'm your host, Lady D. Today's special guest is Join us today for Welcome to my show. Welcome.
Thank you, lady.
Welcome, Ruben Mendiola
Yes.
from the Northeast Ohio Health Insurance Company. Welcome today.
Thank you very much for having me.
Yes, and we have some beautiful weather outside. So look what you
No
brought
snow,
in.
Yeah, no snow, no rain. That's my promise to you today. It was no snow or rain.
Okay, yes,
Yep.
yes. Well, welcome, and we want to inform our audience about the different things that are going on with the healthcare and medical, Medicaid,
Medicare,
and Medicaid, and Medicare, and Medicaid Advantage, and all these different programs that we're just maybe not familiar with.
Sure.
All right, so first, before we get into that, I would love for you to tell our audience a little bit of something about Ruben.
Well, I've been in business since 2009.
Okay.
And my wife and I started into the business during the economy when it went bad. And 2008 is when we got laid off from our jobs over in Cleveland.
Okay.
And a friend introduced me to the Medicare world, and he was my mentor and taught me so much about the business. And we started doing this since 2009. My wife is also a licensed insurance agent, and she takes care of all the administrative stuff back at home. And I'm out in the field in people's homes. We have appointments that we have at various locations throughout the community. And we've been doing this for, like I said, since 2009, and we enjoy what we do. Every day that we meet somebody, it's always refreshing, and it's good to see how many good people out there that are just not knowledgeable about the plans that are out there under Medicare.
Right.
So we enjoy what we do. We enjoy the folks that we work with. As you know, we've been to your home, and we've gone
Yes.
over your insurance with you and your Medicare plan. And there's so much confusion, and it's so overwhelming. You're getting mail. You're getting
Yes.
phone calls.
Yes.
You're getting, you're seeing the commercials on TV. And it's so overwhelming. So we understand that that's a very, crucial time to look at and all that information. And we help, take that confusion out of that for you.
And that I found was so important because, like you said, I was watching the programs and I'm getting out the mails, and then you're getting bombarded with the phone calls.
Right.
And I'm like, I don't know anything about this. I've worked all my life. All I had to do was just say Aetna Health Savings Account,
Right.
and I was done.
Exactly.
It was easy.
So most employer plans, when you're working, they make all those decisions for you, because I was in HR myself.
Okay.
And every year we renewed our benefits with the various insurance companies. They came to us proposing their benefits, their deductibles, their co-pays, and the benefits that are included with that plan. So it was all done for our employees. But now that you're on your own and you're on Medicare, you don't have that HR person to explain that. And that's where I come into play.
Well, I want to know, and this is a very important question because everyone may not be as young as I am.
That's right, yeah. Young and
But-
beautiful, right?
No. But let me just say, what is the age? What is the age that you need to start looking into this?
So typically, if you're 65 and older, is
Okay.
when you are eligible to sign up for Medicare.
Okay.
And you can sign up for Medicare 3 months before you turn 65. And you may also be eligible for Medicare if you have a disability like end-stage renal disease or a Lou Gehrig's disease. If you have some type of disability, and if you've been disabled for 24 or more months, then you're going to be signed up into Medicare.
Okay.
So you can be, two things there is 65 and older is when you're eligible for Medicare, or if you have a disability for 24 or more months, you're put on Medicare.
Now, what is the difference between the two?
What's the difference between the two is that both will still be issued a Medicare card, which is government insurance. Medicare is government insurance, and it offers Part A, which is hospital, and Part B, which is doctors. And under that plan, if you need to go see your doctor, or if you need to go to the hospital, that red, white, and blue card is what you would show whenever you go to the doctor's office or to the hospital.
Okay.
So that's what you would use your red, white, and blue card. And so the difference between that and, say, a Medicare Advantage plan would be that with the Medicare Advantage plan, it combines Part A, which is hospital, B, which is doctors, and D, which is prescriptions. And it combines all in one plan called Medicare Part C. C is in Charlie.
Okay.
And those Medicare Advantage plans include benefits, as you're aware, benefits such as vision, dental, prescriptions, obviously, and then it has transportation. It has over-the-counter items, of which original Medicare does not. They only cover doctor and hospital coverage, and they do not have prescription drug plan.
And they don't have transportation.
And they don't have transportation. Wow. They don't have dental. They don't have all those extra benefits that the Medicare Advantage plans have.
And I want to ask, so why is that?
So what happens is when these Medicare Advantage plans first came out, the government said, you can come out with a plan, and it's privately owned insurance companies that you can enroll into. And the government said, Anthem or Humana or any of those insurance companies, they told them, you come up with a plan, and you become the administrator. And you become the primary insurance.
So is that like when you leave your job and you're retired and they offer you the COBRA?
They offer you your COBRA.
Okay.
And so COBRA insurance is medical coverage, and it's the same type of policy that they get for their employees, except with the employer coverage, there's usually a 70-30 split, meaning they pay 70% of the premium and you pay 30% when you're working.
Right.
But when you stop working, COBRA comes in and they offer that insurance to you, and you have to pay 100% of that premium. Yeah. So, and those plans usually do have prescription drug coverage, but they usually have high deductibles.
Yes.
And they do have high co-payments.
Yes. That's
why when people turn 65, they're like, oh my goodness, well, we're able to afford medical care.
Okay.
And that's the whole idea with Medicare, is they help you with those costs with your doctors, hospitals, prescriptions, and they offer additional benefits. So that's very important to when you change over or where you transition from your COBRA coverage to Medicare Advantage when you turn 65.
Really nice. And also you get the extra perks like working out, going to the gym.
Going to the gym, yes, silver sneakers.
The silver sneakers, yes.
Yeah, so most Medicare Advantage plans that are out there, they do offer the silver sneakers or some type of other gym memberships that you can go to. And you can go to places like Planet Fitness, you can go to the YMCA, and they have different perks within their silver sneakers plans or those gym membership plans. Like if you don't want to go out to the gym, they have exercise equipment that they can reimburse you for, or that they give you, like the stretch bands.
Right, okay, so those things you buy and then you send them the receipt and they send you a check back?
That's for your particular plan.
Okay.
But all kind of different insurance companies, they do offer different type of incentives like that, or they do offer that reimbursement. And as always, we always check to see what those reimbursements are and the different options that are available that fit your needs.
Right.
Exactly.
So your what you do is tailor the services to each individual for what they have already.
Exactly.
And then they have that option to change if they like, or
They sure do. So when we meet with an individual to go over their plan, we do an evaluation. We always check with their doctors and hospitals.
okay,
Because many of the plans, the Medicare Advantage plans, do have a catch in that you do have to select a primary care doctor, and those are the HMO plans.
okay,
And so we always check your doctors, we check your hospital network, we check your prescriptions, we check if what the cost would be for that. So we tailor it to you. And once we put those prescriptions in, we compare your plans against all the other plans that are out there that are available in this area. And some companies will have cheaper costs for their prescriptions
okay,
by going with them compared to going with another plan that may have a higher cost for those same prescriptions. So we always do a personalized evaluation of your prescriptions and doctors and hospitals to make sure it fits your needs.
excellent, excellent, and that's what I really like. So tell me, what do Medicare normally cost? What's
So
the cost?
Medicare Part B does have a premium, and that premium is $164.90 each month. And there are programs out there, and we could always research, and it depends on your income,
Okay,
that can help you with that Part B premium. But typically for the average person, the monthly Part B premium is $164.90.
okay,
You have to pay that each month in order to keep your Medicare Advantage. And when you get on that Medicare Advantage, you have to continue to keep paying that Part B, but also you have to make sure that that you set your red, white, and blue card to the side,
okay,
and whatever insurance that you select, that's going to be your primary insurance.
I see.
So yeah, on average, $164.90 for people that don't get help. And if you're wondering what help or what type of programs are available out there for you, they're all income-based programs out there that will
Okay.
help you with that Part B premium, or there are programs that will help you with your prescriptions, and we'll always research that for you. And depending on your income, you'll be able to find out if you're eligible for extra help for your Part B or for your prescriptions.
Oh, no, that's
And that's
really
no
that's really
cost
good.
to you.
That's good.
And
that's
that's one of the other important things too, is there's no cost to use my services.
You
There's
mean
no,
you
yeah.
cost $0?
Yeah. So there's no cost to consult with me. If we sign you up for a plan, I do
Yes.
get paid by the insurance company.
Okay,
And but yeah, there's absolutely no cost. So if you're worried about having me come to see you and you having to pay me some money, no, that's you will never have that with me or anybody else, any other insurance agent.
you can't get any better service
Yeah,
than that.
that's right.
Someone actually just get in their car as high as gas is today
Oh,
and
no.
come and sit down and go over your health benefits
That's
and,
right.
and what they can offer you.
That's right,
And
for
choosing
sure.
the best thing that's for you.
Oh yeah,
You
yeah,
know,
for sure. Yeah.
and a lot of times your doctors with certain plans you don't even have to change. You can stay within,
Right, and that's the one thing that we want to encourage.
because you know when people get used to, you know, they don't want to change.
Yeah, they
Especially
don't
when
wanna
you're
change
seeing
their
a doctor all year, you know, same doctor for years. You know,
And one thing I found out in this business is folks do not like change. If you've been with your doctor 1 year, 2 years, 15, 20 years, they want to keep their doctor.
right?
So we always want to make sure we check your doctors because we know people just don't like change.
Right. I know.
But we hope we make that transition to change as painless as possible. That's for sure.
Excellent. And then tell me, so why are there so many commercials and TV ads and people calling your phone at this time
Right.
of year? Normally it happens like they start up like October, and you know, and November is just no end to it.
I know it's terrible. You see on TV the commercials with J.J. Walker. You see Joe Namath. You know, get money back now. You know, kind of thing. But yeah, a lot of these companies aren't doing the plans that we offer are typically zero monthly premium for the Medicare Advantage plans.
Okay.
And so the insurance companies aren't offering these plans out of the goodness of their heart. I mean, they're in it for business,
Right.
and they're in it to make money.
Right.
So what happens is when you sign up for, we'll say, Anthem,
Okay.
what happens is Social Security says that we'll pay you to administer the plan, and you can tailor your benefits and offer more or less benefits than any other insurance company that's out there. Of course, it would be to their advantage to make sure that they offer the most amount of benefits, because people will go with that insurance company.
Okay.
So that's how they get reimbursed, is by the government when they sign you up into an insurance plan. So, yeah.
I see. So then, let's see. Are there, I know we talked about the programs for prescription. So, especially for diabetics,
Diabetics.
because the cost for that medicine is just enormously,
Right.
it's overrated.
Yeah, it is.
Because
very
we really have a community that's pretty much flooded with people being diabetic.
diabetic, yeah.
And they
And-
can't afford their medicines, and so
Right.
what do you do about that? How do you assist them with that?
So as we talked about before, when part of our evaluation is we always look at your prescriptions,
Okay.
and when we put those prescriptions into our website that we use, Medicare.gov,
Okay.
and those prescriptions that we put in compare all the costs for including your diabetic medication for all the insurance companies. And so there are a lot of programs out there that even with the insurance companies, they'll help you pay for your lancets, your testing strips, your monitor.
Okay.
And so, but for your insulins, there are insulin programs that are out there.
Okay.
But we put those prescriptions in, and they'll tell us if they're a certain cost with a certain insurance company. But we'll always check that out. And there are extra help that we could always help our folks get to help pay for that insulin.
Okay. That's good to know.
And that's all income based.
Okay.
Yeah,
Okay. So everything
for
is
sure.
according to your income, but
lot
you
of it,
will
yeah.
design a program for them that you customize it to fit that
Right.
person,
Right,
that
right.
individual.
Yeah, because not everybody's going to be able to. I mean, everybody's income is different, and everybody's has different costs for their prescriptions. But if you're at a certain income level, we could always help apply for extra help for you, and get it so that you get lower prescription costs.
Okay.
Yep.
And now, if I wanted additional benefits, how do I go about getting it?
So you would call me,
Okay.
yeah, and we would set up an appointment to either meet in your home. We can meet at a McDonald's, Panera, or wherever you want to meet, and or at a community center, and we would get that information like what we did with you.
Okay.
And we got your prescriptions, we got your doctors, hospitals, and we'll go over all that information to make sure that you do keep your doctor and hospital, and see what your cost for your prescriptions will be. So you would first contact me, and a lot of times I tell folks that you're getting a lot of phone calls, and unfortunately there are a lot of they shouldn't be doing that unless you initiate that contact.
Okay.
It's illegal for people to call you up like that, cold call you.
Okay.
So, yeah, you start by giving me a call, and I'll do the complete evaluation and find out the plan that suits your needs.
Yeah, because it's important, especially for our elders. They don't know, and
They don't know.
sometimes people be wanting personal information that you really should not be giving.
You're right. And unfortunately, a lot of my clients do give their information out over the phone. I mean,
Okay.
you're giving your information out to somebody that you don't know, that could be calling from overseas, that could be calling you, and you're giving them your personal information. And I don't know about you, but that's like giving your Social Security number out. Some people actually ask for their Social Security with them on the phone, and they'll give out their Social Security information.
And now tell our audience, the viewers, the red flags to look for when getting these type of phone calls.
I immediately tell my clients, let it go into voicemail.
Okay.
Yeah, because the red flags are, you hear somebody, usually it's because my wife is turning 65.
Okay. Okay.
So now we're starting to get those phone calls.
Okay.
And I know for a fact we have not initiated those phone calls. So the fact that they're calling you right off the bat, that's a red flag.
Okay. All right.
Absolutely.
All right.
And then as far as with them asking you for personal information, like your social security number or your date of birth or any of that information, that's a red flag. You just don't want to give out your information to anybody over the phone. That's why we always make it. A lot of my seniors want to see me in their home. They want to see the face-to-face, interaction, and because you just don't know who you're talking to on the other line.
Tell our viewers, how can they reach you, Ruben?
You can reach me by calling my office at the number of 216-862-3337. You can reach me by Ruben Mendiola at neohealthinsurance.com. You can also reach me on Facebook. Just type in Neo Health Insurance, and you can access me that way. And then I have my website, neohealthinsurance.com, that you can go to. And we'll be more than glad to answer any of your questions, because we know it's very overwhelming and confusing, and we're there to help you, to eliminate that confusion and get you on the right track.
Now, is there a cutoff period? Because I know when you're working, when I was working, you had to have all this in place by the end of December.
Right.
So now, what's the cutoff period for someone who is, say, getting disability versus someone who's not, far as applying for this insurance coverage?
Okay. So typically, annual enrollment period is between October 15th and December 7th.
Okay.
For those that already have Medicare, that's your chance to review your plan to see if it's going to be what the plans are going to be for next year. And so typically, again, October 15th, December 7th is when you can to make that change.
Okay.
And then...
and if you don't make that change, then you have to keep what you have?
You have to keep what you have.
Okay.
Right?
Okay.
And then they have what's called open enrollment period between January and March. And for some reason you missed that deadline of October 15th through December 7th, you'd be able to have your plan reviewed, and you can make a different choice of a Medicare Advantage plan.
Okay.
The other thing, too, is some people turn 65 at different times throughout the year.
Okay, yes.
So that's a special election period. So say your birthday's in July 1st.
Okay.
So you have 3 months before and 3 months after to decide to get into a plan.
Oh.
And so, and if you get extra help, you can change your plan once a quarter. So there's many election periods and many opportunities for you to look at your plan. But you do have a special election period if your birthday falls in the middle of the year, or if you become newly eligible for Medicare. And so, you do have other opportunities other than that October 15th through December 7th.
That's really good. It's really good to know. And so now, and my other last question would be, so is it a good idea to look at changing your plan yearly, or?
It's always good to have your plan evaluated every year.
Okay.
Come October, I start getting my phone calls. I try to mail out to all my clients ahead of time that October is coming up here real fast. And so August, September is when we get our letters out to inform my clients it's that time of the year in October, and to have your plan reviewed.
Okay.
So it's always good to have your plan reviewed every year.
You hear that? Get your
Every
plan
year.
reviewed every
Right.
year.
And you call me up, and we'll absolutely get you on the schedule, and we'll go over everything like we did on the first time that we met. We'll go over your prescriptions, go to doctors and hospitals, because things do change.
Yes,
so
they do.
every year it's encouraged that you have your plan reviewed.
Excellent. Well, Ruben, I want to thank you for coming
thank
on and being a guest here today.
It's my
And before
pleasure.
we go, I want you to give the audience your contact number, because I know the viewers are listening, and this is so important. If it's not for you, I'm quite sure you know someone who could benefit from this. Please share.
My phone number is 216-862-3337. and I can be reached anytime throughout the day. If I'm not available, please leave your name and number, and I promise I'll get back with you.
Excellent. And if you would like to be a guest on my show, please reach out and give me a call at 216-571-2235. I am Lady D, your host. Make it a great day. Welcome to What's Going On with Lady D today. I'm your host, Lady D. Today's special guest is Join us today for another breakthrough conversation